But I want to zoom out because before we started recording, you were talking about how the flood of statements that have come from RFK creates work for you. You effectively, every time he says something about vaccines, what happens? Do you have to go on social media and clarify? Or do you get an influx of patient questions? What's been the life in Dr.
Well,
Peter's
I had
since
been
he became?
hoping as COVID started to wind down, that I could retire my TV career and just stay focused in the lab and doing my writings. But Mr. Kennedy seems determined to call me out of retirement. And yeah, so he's every few days he's just coming out with some zinger. So, for instance, a few days ago he says the MMR vaccine is, I mean, we can go through the list. He says it's I don't know, something like it's got aborted fetal debris or something along those lines. Well, first of all, the MMR3 viruses, the first two M's are measles and mumps, and those are grown in chick embryo cells. So there's certainly not. And then the R, the rubella, the virus that's from a cell line that's been propagated for more than 60 years. It originally came from, I believe, two aborted fetuses back in the early 1960s, but they're propagated on cell lines over decades, and there's certainly no aborted fetal material. And the Vatican has weighed in on this, and they're very comfortable with that. And so he just makes this very reckless statement about aborted fetal debris, and I think it's irresponsible, and it frightens people. And but then it continues. Then he made a statement that the protective immunity. First of all, he said the MMR vaccine's a leaky vaccine. I'm not even sure I know what that means. I guess he means that it has unreliable effectiveness, which is nonsense. It's one of the most effective vaccines that we have. Maggie, when I, as a vaccine scientist who develops low-cost vaccines for parasitic diseases, made a low-cost COVID vaccine reaching 100 million people. When we're doing our vaccine design, my aspiration is to make a vaccine as good as the MMR vaccine. It's one of the most effective vaccines we have, 90% one dose, 97% two doses. So it's not leaky at all. And then he says it declines with 4% protective immunity, talking about the measles epidemic every year. It's absolute nonsense. I mean, if it declines at all, there was one study, modeling study, where it declined 0.04% a year. So that's 100-fold less. But then he continues, he starts drawing this false equivalency between getting the MMR vaccine and this useless cocktail of interventions, budesonide and vitamin A and clarithromycin, appealing to the health, wellness, and influencer industry. He says the measles hospitalizations are due to quarantine or isolation, when it's nonsense. These are sick kids in the hospital. We've already had two pediatric deaths and otherwise well school-age kids who were denied access to vaccines. And so it just becomes this exhausting exercise to continue to have to debunk things that he says on a regular basis.
Would you go as far as saying it is undermining public health?
Well, it erodes trust in our nation's vaccine ecosystem, which has been highly effective, has led to the elimination of multiple childhood infections. I mean, when I was a pediatric house officer, a resident in Boston, I was admitting a child every couple of weeks with Hib meningitis, Haemophilus influenza type B meningitis, a bacterial meningitis. It was devastating. Kids died, permanent neurologic injury. It was devastating for families. It was devastating for the house officers taking care of those kids. Every couple of weeks, I was admitting a child with that in my pediatric service in Boston, and now the disease has been eliminated. It's disappeared, and it disappeared just over a few-year period. I don't want to bring that back. And measles, we eliminated measles in the year 2000. And now have had sustained measles transmission in my state of Texas, in the western part of Texas, West Texas, and the Panhandle, now moving into neighboring areas of New Mexico and Kansas and Oklahoma. and it doesn't seem to have an end in sight. It's still going pretty strong, and if it continues for many more months, we'll lose our measles elimination status as a country, which was a hard fought gain. So with him piling on, making these reckless statements, it has no positive benefit and only serves to undermine public health.
Dr. Peter Hotez, thank you so, so much for joining us and explaining the way vaccines are developed and are effective. We really appreciate your time today.
Thanks very much, Maggie.